basically are your reader's scope, but you guys can use it for a bronch. So you have a 3.5 and a 5.3, so whichever one the doctor wants to use, that's all they'll do. You can probably get like 6 uses out of it before it'll probably shut down officially. But yeah, they're technically disposable, but you're gonna have a fabulous digital image for that. As far as cleaning brushes go, we don't really have any because they're disposable at the end of the day. So I'll try to see if I can find some kind of small cleaning brush that fits through, and you can use that because you definitely have to clean them if you're gonna reuse them. So that was that. And do you guys do any kind of like odo here, like any kind of rigid endoscopy, like with a rigid scope? Just because, I mean, I think this came with the kit, but you also have a handheld camera. So this is specifically used with rigid scopes. So what you would do is you would turn it clockwise and you would snap the scope in here, and then this would actually go into the same port, so at least you can see the same image. So you guys can see the two little arrows right there. So the arrows would go side by side into here. You click it in, and then you're supposed to get an image right there. So as you can see how it's like kind of green. So let's try to light balance it. I might have to have a light source on it. Yeah, there you go. See how it turned, like it went from green to white, like the red color. So that's the purpose of light balancing it. So for this camera, all you have on here is a focus ring. Like I said, if you want to zoom, you can do like a zoom portion right here where you can zoom it in. That's about it. So you would have a rigid scope. I don't know if you guys have any rigid scopes around, but the rigid scope is snap into here. And then we also have a light cable. So what this light cable is going to be used for is you're going to take this adapter, see how it has that long stem. You're going to snap it in to there. And then your light cable snap right into here. So when you turn on your light source, the light's going to come out of there. So you'd be able to plug that into the bottom of the scope. I just don't want to shine into your guys' eyes because it's so bright. But you would have the scope plug into here, and the light cable plugs into here, and then you'd be able to do like an ear check or nose check, whatever you guys have. Do we have any kind of those scopes here, like an ENT scope?
Yeah, I know they have like nanoscopes and like arthroscopic stuff.
Yeah.
Could it be used for the same purpose?
Use it for ortho. Yeah, absolutely. So I mean, this is probably like more like a portable card. So I don't know if it's you guys have that.
Yeah, no. We have like the big new boom machine.
I was gonna say you have the nice area, so you're gonna use it for that. But I mean, let's say in a pinch, if there's ever like a power outage or something like that, you can actually use this as emergency backup. So it's not a bad deal for you.
Cool.
But that's it. No, I talk a lot. So, and then the last thing I would say is for maintenance of everything. So you guys have a nice little drawer here. I never, ever leave anything out. I always like to keep it just snug inside just because you never know who's gonna come by. And then for the scope, along with the cleaning, we do what's called a leak test. So sometimes I'll get calls and they'll say like, hey Dave, like, you know, the image on the scope is really bad, it's really jittery. So sometimes I'll just say, hey, let's take what's called a leak test. And what this does is it finds if there's any holes in the scope, just because like I said, the teeth are very sharp on, you know, your patients. So what we'll do is we'll plug you have to make sure the cap is on here. And if anything, I'm right down the road so I can do this for you. But what we do is we push the gauge up to 200. And the reason I know it's 200 is because you see this little blue bar, it just goes up to 200. And you just want to make sure that that needle just stays steady. So if you if you start pumping this up and the needle just already starts to go down, that means there's air escaping from something, and that means the scope has been compromised. If that needle is staying right where it is, which is perfect, that means the scope is good to go. So then you always want to deflate it right before, and then remove the scope. And I do recommend doing this before you put in the gas sterilizer. just a good habit to have, just so you can be on top of it. And then, yeah, let's say you're putting in the gas sterilizer. You're going to put the cap on, rotate it, and then it's good to go. So biggest things for maintenance of the scope is never, ever, ever let water go in here. There was a hospital here in Florida, I won't name names, but it rhymes with University of Florida. They reached out and they're like, oh, you know, there's a lot of image issues, and I said, it's probably water in the housing. They're like, oh, there's no way, and I literally took it, I opened it, and I poured out water, like it was that bad. So they're like, oh, we didn't know how it got in there. So I don't know if someone, and always whenever you're putting the cap on there, sometimes it can go at a bend or something, so always just make sure it's firmly seated. And you can hear that click. Always look around just to make sure that, you know, it's not kind of bent or anything, because water going, it's a very expensive scope to repair. So just do everything you possibly can to make sure no water goes in there. And then especially hanging the scope too, you never want to like just pull down. There's just so many easy ways to just make this scope last as long as possible. So if you're able just to go through all that, you'll be fine. Yes?
What are some common like things that where water can get in?
So cleaning. So it's every time it's cleaning, because at least when you're plugging into there, you're always like, the cap comes off, the cable goes in. It's just that, I mean, I've even walked into places and the cap is just like hanging off. And I mean, as a rep, I'm always freaking out just because I'm like, it's such an easy, you know, mistake to make. So just every single time, if there's no cable plugged in here, this thing always needs to be on there as well. I've seen people clean it sometimes, and they'll literally take this off and clean around it. I'll be honest with you, like when it comes to cleaning and submerging, I don't even really like to submerge this, just because it goes into the monitor, right? It's not, you know, affecting the patient. So sometimes whenever they submerge the whole scope, I literally just leave this hanging out. If I own the scope, that's what I would do. So if anything, if you have like get scared, maybe just take like an alcohol wipe and just wipe all around it, but it's plugging into the monitor. My opinion, I think from here all the way down, that's going to be, you know, your primary. You want to make sure it's clean. Always emphasis on clean. Oh, never use rubbing alcohol. I had one account that they would shoot rubbing alcohol to dry it out. Since this is rubber, it actually causes it to crack and it'll break the scope. So just every single time, start off with enzymatic cleaner. After you're done with the enzymatic cleaner, you use water, flush everything out. You don't want like an ounce of enzymatic on there. And then dry it off completely. Do you guys have those air compressors?
We have one in sterilization, like an actual like big air compressor.
So I would say don't use it.
Or we have the condensed air cans too. So I mean, if that's a little better.
Because sometimes, so I don't mind it on like the outside. I mean, even just it's put on our IFUs. It's supposed to be a towel. You're supposed to use a towel and wipe it. But I've had some places like at other hospitals, they'll put the condenser like into here, and they'll blow it out. Granted, they have the right intentions, but you can actually blow the scope out and break it. Yeah, I know. So that's why it's like one of those things where it's like if I own the scope, I would even take like a syringe and just like push air through it. I mean, just treat it like a baby. You know, if you treat it like what it's worth, you'll get the longest lifetime out of it. So it is a pain to clean, but if you take, you know, the right time, maybe trade off on it. Whoever cleans it and figure it out. So I think the biggest things are going to be emphasis on, you know, using the brush, and obviously use your own judgment, but also on the human side, there's been facilities here that they would constantly reuse brushes and bacteria would get stuck on here. So like all it takes is one bad patient and then the bacteria would live inside the scope because constantly using the same brush, and then that affects, you know, everyone else using it. So personally, I always take the emphasis on the single-use brush. Just use it one time, clean it, throw it away. They come in like a box of 50, I want to say, I think, are these here?
Yeah.
Yeah, these are your brushes. You have 50. So, I mean, if anything, when you get down to like 20, order another box or something like that. And then, yeah, it needs to be completely dry before it goes into the gas sterilization. I think the gas sterilizer would stop if there's moisture or something in there.
We haven't ran into that issue, thank God. We keep it, you know, we try to keep all the instruments, whatever's going in the gas, pretty dry.
And is it a Sterad, do you know?
Anderson, EO4
I'll look
gas
at
sterilizer.
to make sure that's approved.
Yeah, we will use ethylene oxide, so I don't know if that's.
I'll look into it.
Okay.
Because even worst case scenario, you can even just get away with cleaning with enzymatic cleaner and just
And just kind of just let it hang and.
yeah, just let it hang. That's what everyone else does. You know?
Okay.
So, I'll take a picture of it before I leave, and I'll call the company and see if that's okay.
Okay.
Worst case scenario, if we just do a basic cleaning, like just enzymatic, washing out the water, hanging it to air dry, that's gonna be a
Good enough.
better option.
Okay.
Yeah. Forceps. You guys have several forceps. You have a biopsy. You have a grasping forcep. Another serrated cuff. Also, you guys have these fancy baskets, which are awesome. So let's see if it. So what I like to do is, it's most likely gonna be you guys doing it, right? So the doctor will feed this through. So I always use 2 hands, and I slowly go like this. So we have like a basic basket right here to grab some foreign objects, and then I always slowly retract it. I think this one right here is like the big one. So have you guys had any foreign body procedures here yet, or have you had any calls about stuff? What are the foreign bodies usually? Is like tennis balls or
We have everything.
everything?
Anything you can imagine.
So,
Earrings,
Tampons.
oh really?
Socks.
Yeah.
So this one I love because this is like tennis balls. So I was down in Marathon, the Keys last week. So a sea turtle ate a sponge, so it was cleaning the tank, and then the sea turtle ate the sponge. So this is what they used. So they went in there, and obviously it's going to be you guys doing it just because a doctor can't hold the scope and deploy. But this is probably going to be like your most popular one. Like I said, you don't want to go like too fast just because these are delicate instruments. So just always go kind of slowly if you can. It retracts all the way. You do have a cleaning port in here. So what I do is I always open it, and for cleaning, I'll have the whole thing open and I'll just literally dip it. I don't try to like use my fingers and wash it. I just dip it, and if you see any kind of like bioburden or something like that, obviously try cleaning it off. But just try dipping it, and then also you have a little port right here where you can put your syringe and then shoot the fluid down here to kind of clear the whole thing. Same thing, you want to do like an enzymatic, and then follow it by a water. So you just want to flush, just keep flushing the water in there until all the enzymatic's gone, and then a slow retraction. The biopsies, I mean, these are pretty self-explanatory too. You can just slide them through. They're stainless steel. All you do is you just do a basic cleaning of this, make sure they're dry. And a lot of times, I don't have like a hook for you guys, so we do have. So this is like an IV pull. So we used your IV pull to hang the scope. I don't know if you guys want to sometimes maybe have an IV pull or stick this on there. These have little loops on them, so you can hang them on there, so you can keep them right next to there. Whatever floats your boat. Trying to think. I think that's pretty much it. Any questions? I know it's just me just aimlessly talking. So, but I would love for you guys to at least try giving a shot plugging it in. So if we want to start doing that, whoever wants to